The background is that we have just limited information. There are very small registry, like 100 patients, 90 patients. So we need to go forward to get a very large registry. And actually we have right now 1,000 patients. We included 12 hospitals between Italy and Germany. We are very lucky. They are mainly university hospitals with prospective register. This is why we believe that we have some good data that we can share with the scientific community. Yeah, at the EHRA meeting, as this is our arrhythmology meeting, we try to focus on not on arrhythmia, but on some feature, electrocardiographic feature, which is persistent ST elevation. So we checked if patients with Takotsubo, sometimes they come like 40% with ST elevation. How is going on, this ST elevation? After 48 hours, we check how many patients do still have ST elevation, and what is the meaning of that. We saw that like 11% of these patients, they still have it, and if they do have it, they have a very high risk of in-hospital complication, mainly LV thrombus formation. And then also at long-term follow-up, there is a slightly trend of higher mortality, but for sure is a statistically significant trend about MACE, so major cardiac events. So it is a simple stuff that maybe physicians should check for after 2 days of hospitalization for Takotsubo syndrome. We are working about some predictors of this Takotsubo cardiomyopathy, especially predictor of prognosis. We recently found, for example, about atrial fibrillation. If patients with Takotsubo come with atrial fibrillation, has a high risk of events during hospitalization. We even focus about diabetes. We recently published on diabetes care about that. We found that even diabetes is a very high risk factor for this patient. And the next step is also, which is the treatment of this patient. We checked about LV thrombus in Takotsubo and how they have to be managed. And we found that, for example, in 3 months, oral anticoagulation, it's enough for this patient. These patients, they do need long-term anticoagulation, but we are still looking for which is the real therapy of this patient. Nobody knows right now. The aim is doing a randomized trial and try to see if beta blocker, ACE inhibitors, if these drugs, they work or not. We still don't know, but this is the main goal of this trial, to go ahead and spread our scientific finding to all the scientific community. I presented these results on behalf of Professor Brunetti, which is the chief of the University of Foggia in Italy, and also of Professor Atrial, which is the chief at the University of Lübeck, Germany. I thank their support. They helped me a lot to perform this study. There are this very nice finding about oral anticoagulation, how it has to work for AFib ablation. I think it's very important because we have to be aware that we have this drug, and uninterrupted oral anticoagulation, I think it's very important to reduce complication. So I am an electrophysiologist, I do also AFib ablation, so I think it's a very important finding.